3 minutes past 2 in the afternoon, and the gym smelled like rubber mats and antiseptic, the same way it always did, the same way it probably always would. Nadia Ostrowski was wrapping a soldier's knee when the shouting started outside. She did not look up right away. That was the first thing anyone watching might have noticed. Every other person in the rehabilitation wing of the troop medical clinic at Fort Drum paused, heads turning toward the window, toward the sound of voices climbing over each other in the parking lot. Nadia finished the wrap. She pressed the edges flat with her thumb. She told Specialist Graves to flex and hold. Only then did she stand and move to the window. There were 4 soldiers in the lot. One of them was on the ground, not sitting, not crouching. Down flat on his back on the asphalt, and the 3 others were standing over him in that particular way people stand when they don't know what to do next, but feel like they need to be close to something. One of them had his hands on his head. Another was already on a phone. Nadia was already moving. She was through the door before any of the other clinic staff registered what they were seeing. She crossed the parking lot at a pace that was not quite running, but covered ground the way running does. And she was kneeling beside the soldier on the ground before the man on the phone had finished telling someone on the other end of the line what the address was. The soldier was a staff sergeant. His name tape said Reinhold. He was conscious, but only barely, his eyes doing that slow drift and return that meant his brain was somewhere between here and somewhere else. His left leg was positioned wrong. Not a small wrong. The kind of wrong you feel in your own body when you look at it. Nadia asked him his name. He told her. She asked him to squeeze her fingers and noted how much pressure he gave. She ran her hands along his leg without hesitating, and her face gave nothing away when she reached the point above his knee. She told the soldier with his hands on his head to take his jacket off and roll it tight. She told the one on the phone to tell them a possible femur fracture, no external bleeding visible, patient conscious and oriented. She positioned the rolled jacket under Reinhold's head. She kept talking to him in a voice that was level and unhurried, the way a radio signal is level. No peaks, no breaks, just steady transmission. When the medics arrived 6 minutes later, the staff sergeant was still conscious. His vitals were stable. Nadia gave them a rundown so clean and fast that one of the medics, a young specialist named Dufresne, looked at her for a moment with an expression she had learned to recognize over the past 14 months at Fort Drum. It was the expression of someone recalibrating. She did not wait for him to say anything. She thanked him. She went back inside. She finished wrapping Specialist Graves's other knee. Nobody said anything about it that afternoon. They rarely did the first time. The story of how Nadia Ostrowski ended up as a civilian physical therapist at a military installation instead of doing almost anything else with her particular set of skills begins the way most honest stories begin, not with a single dramatic moment, but with a long, slow accumulation of decisions that only look inevitable after the fact. She grew up in Hamtramck, Michigan, which is a city surrounded on all sides by Detroit and has been shaped by that fact in the way a child is shaped by a difficult parent, simultaneously harder and more tender than the outside world expects. Her father was a mechanic. Her mother worked the line at a food processing plant for 16 years and then managed the plant for another 8. Nadia had one brother, Tomasz, who was 4 years older and the kind of person who filled every room he entered, not with noise exactly, but with presence, the sense that something important was about to happen. Tomasz enlisted in the army the summer Nadia turned 15. She remembered the day he left because it was the first time she understood that people could simply choose to go somewhere, to step out of the frame of everything familiar and into something larger. She had stood in the driveway and watched the car with her brother in it get smaller and smaller until it turned at the end of the block, and she had felt something that took her years to properly name. Not sadness, not pride, something closer to recognition, like seeing a door and understanding for the first time that it opened. She was 22 when she enlisted herself, 3 years after graduating high school, and spending those years doing community college coursework and working at a physical therapy practice run by a former college gymnast named Barb, who had strong opinions about fascia and stronger opinions about people not meeting their potential. Barb had recognized something in Nadia early, some combination of patience and precision and an apparent incapacity for panic, and had started teaching her in earnest. By the time Nadia shipped to basic training, she could assess a rotator cuff injury by watching someone walk across a room. She enlisted as a 68W, a combat medic, because it was the closest available category to what she already knew how to do, and because Tomasz had been a 68W before cross-training into something he was not allowed to discuss with her in any detail. She went through OSUT at Fort Leonard Wood in the heat of a Missouri summer, and she was good at it in the way people are good at things they were already partly built for. She was methodical. She was fast when fast was needed. She had the particular quality, rarer than people imagine, of performing better under pressure than in practice. After her initial training, she was assigned to the 10th Mountain Division at Fort Drum, which is located in the extreme north of New York State, near the Canadian border, in a part of the country where winter arrives in October and leaves whenever it feels ready. She spent a year there, then deployed to Afghanistan, specifically to a forward operating base called FOB Salerno in Khost Province, which sat in a bowl of mountains that turned colors at sunset, that had no adequate names in any language she spoke. That was 2012. She was 24 years old. FOB Salerno was a busy installation by the standards of that particular moment in the war, which means it was simultaneously too quiet and never quiet enough, the kind of pace that keeps your nervous system permanently elevated without ever giving it a clear target. Nadia worked the aid station. She went out on patrols as the attached medic for a rifle platoon from Bravo Company. She learned the particular geography of that valley, the way the ridgelines changed character, depending on the light, the places where the road narrowed between walls of pale rock and the air got cooler even on hot days. She was good enough at her job that her platoon sergeant, a warrant officer named Boateng, who had been in Afghanistan 3 times previously and had the weathered certainty of a man who had been right about things and wrong about things in roughly equal measure, started treating her opinions as data rather than noise. That was not universal. There were soldiers in the platoon who were polite in the way people are polite to someone they do not quite take seriously, and she learned to read that too. The half-second delay before someone follows your instruction that tells you they are deciding whether to. The bracelet appeared on her wrist 6 weeks into that first deployment. It was a simple thing, dark green paracord in a Solomon bar weave, no clasp, just a loop. A kid from Coast City who sold fruit and sometimes information had made it for her after she treated his younger sister for a respiratory infection that the family had been managing with prayer and boiled herbs and increasing desperation. He had pressed it into her hand outside the wire and said something she could not translate, but that her interpreter told her, after some hesitation, meant approximately that she had soldier hands, but did something healing with them. She had worn it every day since. Tomasz had seen it when she came home on leave and had not said much about it, only turned it over on her wrist once and then let it go. Tomasz understood things without requiring explanations. That was one of his primary qualities. After her second deployment to a combat outpost in Logar province that she would describe later only as very cold and very far from anything, she applied to Ranger School. This was not done casually. This was done after a year of preparation and a conversation with Boateng that lasted 2 hours and covered territory ranging from the physical requirements to what she was actually looking for, and whether she had thought carefully about what she was willing to cost herself. She had thought carefully. She was willing. She graduated Ranger School in the class of 2015 at 32 years old. She was not the first woman to do it. She was in the second class after the integration. The 2 women in the class before her had become something close to mythology in the time since, and Nadia had spent the 61 days of Ranger School trying to interact with that mythology as minimally as possible, trying to simply be a student in the school, because the moment you started thinking about what you were proving, you stopped being able to just do the work. She went back to Fort Drum. She did another deployment, this one to Djibouti, attached to a special operations task force, doing work that her security clearance permitted her to know about, and her inclination declined to describe. She came home from that deployment on a Tuesday in February, with a shoulder that had been improperly treated after an incident she wasn't authorized to discuss, and a decision already forming that would take her another year to fully articulate. She separated from the army at 35. She went back and finished her kinesiology degree, added a master's in physical therapy, and applied for a position at the Troop Medical Clinic at Fort Drum. She had chosen Fort Drum deliberately, the way she made most of her choices, which was quietly and without performance. She was home, in the sense that she had come to understand home, not as a specific address, but as a place where the work mattered and you knew the weight of what it meant. She did not list her Ranger tab on her application. She did not mention the deployments in detail. She listed her service, her honorable discharge, her education. She got the job based on those things. She kept the rest in a box she only opened for herself. The bracelet on her wrist. The only thing she wore every day. The only thing she had not put away. Fort Drum in January was the kind of cold that is not merely climatic, but philosophical. The air had a quality of opinion to it, a firm insistence on the terms of engagement. The trees along the post roads stood bare and exact against a sky that was the color of old metal. In the clinic parking lot each morning, there was a layer of ice that the facility's staff salted with evident fatalism, knowing it would return by mid-afternoon. Nadia arrived at 06:45 each day, 30 minutes before her shift began. She made coffee in the small break room. She reviewed the day's patient schedule. She set up her treatment space with a precision that a visitor might have found excessive, each item in its place, nothing left to chance or improvisation. Her patients were mostly younger soldiers with the particular constellation of injuries that come from training hard in cold weather, knees and ankles and backs bearing the accumulated weight of ruck marches and airborne operations, and the kind of casual physical punishment that army life administers without intent or apology. They came to her skeptical, the way young soldiers are skeptical of everything that isn't directly proven, and they left her appointments with their skepticism largely intact but directed elsewhere, because her treatments worked in a way that was hard to argue with. She had a supervisor named Captain Verrill, who was a pleasant man with an administrative disposition and a talent for scheduling that bordered on artistry. He liked Nadia because she was never late, her paperwork was impeccable, and she did not generate complaints. He did not fully understand her, but he did not need to. She produced results. Fort Drum did not suffer that at a shortage. The other physical therapist in the clinic was a civilian contractor named Mark Peterson, 47, from Minnesota, who had spent his career working with athletes and had taken the Fort Drum position because his wife had family in Watertown and they had been looking for a reason to come north. Explained to Nadia the correct way to use a goniometer, which she had been using correctly since she was 19 years old. She had listened. She had thanked him. She had made a private note of the interaction and moved on. There was also a rotating cast of medics and nurses and the occasional physician who came through the clinic, and among these, the one Nadia noticed most was a young sergeant named Patel, Deepa Patel, 23, sharp in the way recent graduates are sharp, everything still fresh and not yet worn into the shapes that experience makes. Patel had a quality of attention that reminded Nadia of herself at that age, the particular focus of someone who is genuinely trying to learn rather than performing the appearance of learning. Patel watched Nadia work. She did not make it obvious, but Nadia noticed. The bracelet. She still wore it. 14 months at Fort Drum, and it was still on her left wrist, the paracord dark now with wear, the weave tight and perfect, the way handmade things are sometimes perfect in a way that manufactured things aren't. She turned it sometimes when she was thinking, an unconscious movement. Patel had noticed that too, had asked once what it was, and Nadia had said only that someone had given it to her a long time ago, and that she kept it as a reminder. Of what? Patel had asked. Of what matters, Nadia had said, and that had been the end of the conversation. There were things she did in the clinic that drew the occasional second look. The way she moved around a patient in distress, an efficiency of motion that implied a familiarity with urgency. The way she assessed injuries, fast and thorough, and without the tentative quality that suggested she was consulting a mental checklist. Once, when a soldier came in hyperventilating from an anxiety attack in the waiting room, she had managed his breathing with a calm authority that had the effect of ending the episode faster than anyone who had witnessed it could fully account for. When Captain Verrill had mentioned, carefully, that her response seemed unusually confident for a clinic environment, she had told him that she had worked in high-stress medical situations before, He had nodded, as if this explained things, though he had not pushed for specifics, and she had not offered them. The parking lot incident with Staff Sergeant Reinhold had happened in November. By December, she was aware of a shift in the temperature of her professional environment, a quality of attention from people who had not paid her much attention before. It was not dramatic. It was more like the way a room changes when the light changes. The same furniture arranged the same way, but everything looking slightly different. Specialist Dufresne, the medic who had taken the transfer call in the parking lot, had started lingering near the clinic entrance in the mornings in a way that seemed accidental, but was not. Sergeant Patel had stopped asking her questions about techniques and started asking questions about history, how long she had been in the army, what her MOS had been, where she had deployed. Nadia had answered all of it accurately and without detail, and had redirected the conversations with a skill that she had developed over years of interactions she did not want to have. She was not hiding because she was ashamed. That was the thing that required understanding. She was not concealing her history from embarrassment or from any desire to be something she was not. She was concealing it because she had watched what happened when a certain kind of past became known, the way people started processing you through the filter of what they expected, rather than seeing what was actually in front of them. She had spent her career being seen through filters. She had found, after a while, that she preferred to be seen. The work was better this way. The patients responded to a physical therapist who was a physical therapist. They opened up about their pain, their fears about losing fitness, their anxieties about whether they would be able to return to full duty. They trusted her with their bodies in the particular vulnerable way that people trust someone they believe is focused entirely on the task at hand. If they had known what she had been, some of them would have relaxed further. Others would have stiffened, changed their words, performed instead of simply being there. She preferred them simply being there. She preferred being simply there herself. This was working fine. The arrangement, the quiet professional identity she had built and maintained until the afternoon of January 14th, which was a Thursday, and which turned out to be the kind of day that reorders everything that comes before and after it. The day had started like any other winter day at the clinic, which is to say grey and steady and purposeful. Nadia had 4 patients scheduled in the morning, 2 post-surgical knee rehabilitations, and a shoulder and a back. She had completed them all by 11:30. She had eaten lunch at her desk, a thing she did because she preferred working to watching other people eat, and had started on paperwork when the call came to Captain Verrill's office. She heard his voice change register through the wall. That was the first signal. Verrill had a telephone voice that was professionally level, and when it broke from that level, the cause was always significant. She heard the word mass. She heard the word casualty. She was already standing before he appeared in her doorway. He told her that there had been a training accident at the range complex, 7 kilometers from the main post. A Stryker vehicle had experienced a mechanical failure on an iced road and left the road surface at speed, rolling down an embankment. There were 11 soldiers in the vehicle. The initial report from the range control NCO indicated multiple injuries, 2 soldiers unconscious, 1 with suspected internal injuries, 3 with fractures, and the rest with varying degrees of trauma. The installation's emergency medical response was en route, but they were 8 minutes out, and the range was more than 6 kilometers from the nearest trauma facility. The clinic was standing up as a staging element. Within 3 minutes, the clinic had transformed from its Tuesday rhythm into something else entirely. Verrill was coordinating with the hospital. Peterson was setting up the back examination room as a temporary triage point. The medical staff were pulling supplies. Nadia was doing the same, but she was also, without making it explicit, making a series of assessments about what was available and what was not, and what a mass casualty event with this profile would require. She asked Verrill where the hemostatic gauze was. He looked at her with a brief expression that suggested this was not a question he had expected from a physical therapist. She told him she had TCCC certification. He pointed her to the supply cabinet. She was already moving. She pulled a kit together in 2 minutes, the kind of kit that has a specific logic to it if you know what you are building, and no logic at all if you don't. Tourniquet 2, CAT models, hemostatic gauze, chest seals, both vented and non-vented, NPA with lubricant, trauma shares, pressure dressing. She looked at what she had and made one addition, a second tourniquet, because fractures from vehicle rollovers in this weather sometimes complicated faster than they presented. Patel was watching her from across the room. Nadia noticed and said nothing. The first vehicle from the accident site arrived at 15 minutes past 1. It was a HMMWV that had been at the range complex for a different exercise and had been commandeered by the range safety officer, a senior NCO named Sergeant First Class Carver, who had recognized that waiting for the formal response was a choice he was not willing to make. He had loaded 4 soldiers into the vehicle himself and driven to the clinic because it was closer than the hospital, and he had made a calculation. Nadia met them outside. The first soldier out of the vehicle was mobile, but holding his right arm against his body in the position that indicated a fracture or severe dislocation. She directed him to the waiting room and told Peterson by name to handle him. Second soldier was helped out by 2 others, a woman, private first class, conscious but glassy, a cut above her eye that had bled freely and now showed the particular darkening at the edges that indicates time has passed. Nadia assessed her for 2 seconds, applied pressure with a gloved hand, told her to hold it herself and stay seated, and moved to the third soldier. The third soldier was Carver himself, who had refused to acknowledge until this moment that he had something wrong with his leg. He was standing, which told her the leg was bearing weight, but he was standing wrong, the kind of wrong that is a compromise between pain and pride. She did not argue with him. She told him he needed to sit down so she could see what they were dealing with. He sat. The 4th soldier was unconscious. He was being held in the back seat by another soldier, a young corporal named Winstead, who had been talking to him for the entire drive, and whose voice had the particular, exhausted, over-controlled quality of someone who had been talking for a long time, because stopping felt dangerous. The unconscious soldier was breathing, but the breathing was wrong. The sound of it was wrong, wet and effortful, and irregular in a way that had nothing casual about it. Nadia leaned in. Her hands moved without ceremony. She checked his airway, checked his pulse, put her hands on his chest and felt the movement and the lack of movement, and interpreted both. She looked at the entry point below his left arm where the Stryker's interior had done something during the roll, and she felt for what she was afraid she might find, and found it. Tension, pneumothorax. Air accumulating in the chest cavity, compressing the lung, building toward cardiac arrest with the unhurried inevitability of a physical process that does not negotiate. She called to Patel without looking up. She told her to get Captain Verrill out here right now. She told Corporal Winstead to keep talking to the soldier, that his voice was doing something useful. She reached into her kit, and her hands found what they needed. The chest seal went on with a speed that stopped the corporal mid-sentence. Nadia kept her hands on the soldier's chest and felt the change begin, the small hydraulic shift as the pressure found somewhere to go. She watched his breathing. It changed. It was still wrong, but it was less wrong. The improvement that is not recovery, but is the bridge to recovery. The thing you buy with fast hands and correct knowledge until the people with the right equipment arrive. The medics from the installation's emergency response arrived 4 minutes later. The lead medic was a staff sergeant named Okoro, experienced, efficient, who came to the back of the HMMWV and saw what he was looking at and asked Nadia a series of rapid clinical questions to which she gave rapid clinical answers, the kind of information exchange that happens between people who are operating from the same frame of reference. Okoro did not ask who she was or what her background was. He asked whether she had done anything else besides the chest seal. She told him no external hemorrhage visible, no NPA placed. Pulse was present and strengthening. He told the soldier behind him to get the sked stretcher. He looked at Nadia once more with the expression Dufresne had used in the parking lot, but more pronounced. And then he was moving, and she stepped back and let the system she had been holding in place transfer to the people whose formal job it was. The next 40 minutes were organized chaos, which is the best kind of chaos. The kind that has a structure underneath it that keeps the worst outcomes at arm's length. Nadia worked the room. She moved between the wounded soldiers, handling the things that could be handled at her level of certification, escalating what needed escalating, staying out of the way of what didn't need her. She redressed the cut above the female soldier's eye. She helped immobilize the arm fracture. She sat with Sergeant First Class Carver while they waited for X-ray confirmation on his leg and told him he had made a good call driving them here. He said he'd made the only call. She said that was what good calls usually were. His leg was fractured, tibia, clean break, and he would be in a boot for 6 weeks and physical therapy for another 8 after that. She told him she'd probably be seeing him. He looked at her without knowing who he was looking at and said he'd be glad for the help. When things had settled to the point where settled was the right word, Nadia washed her hands and returned to her workspace and sat down, the adrenaline clearing, the particular quiet of the aftermath. Sergeant Patel appeared in her doorway. She stood there for a moment, and then she asked if she could come in. Nadia said yes. Patel did not ask the most direct question first. She asked how Nadia had known what to do with the chest seal. She asked about the kit, why it had been assembled the way it was. She asked about the questions she had directed at Captain Verrill about the hemostatic gauze. She was constructing something, approaching it from multiple angles, and Nadia watched her do it with a quality of recognition that was not entirely comfortable. Finally, Patel said it. She asked if Nadia had deployed. Nadia said she had. 3 times. Patel asked, as what? Nadia said, as a medic. Patel looked at the bracelet on Nadia's wrist. She had looked at it before, but now she was looking at it differently, reassembling what she thought she knew. She asked if that was all. The room was quiet. Outside the window, the January cold pressed against the glass with its philosophical insistence. Nadia looked at the bracelet. She turned it once on her wrist, the unconscious motion, and she thought about the kid in Coast City with his fruit stand and his careful hands, and she thought about what her interpreter had translated. Soldier hands, but healing things. She told Patel that no, that was not quite all. She told her about the Ranger tab without making it a dramatic reveal. Told her the way you tell someone a fact that is simply true. That she had completed Ranger school in 2015. That she had spent the better part of a decade doing work that required both the medical training and the other kind. She told her that she had separated because of a shoulder injury that she had managed, and that had eventually managed her, and that physical therapy had always been where she was headed, even if it had taken a long route to get there. Patel was quiet for a moment. Then she said she was glad the soldier in the HMMWV had made it, the one with the chest injury. Nadia said she was too. Patel asked if she could come in early on Monday to talk about TCCC. She wanted to understand the clinical reasoning behind the interventions she had watched, wanted to understand them properly, not just the mechanics. Nadia said yes. She said to bring questions. The word got around the way words get around on military installations, which is to say faster than seems physically possible given the distances involved, and with a fidelity to the core facts, if not always the surrounding details. By the following week, there was a different quality to the way people moved through her workspace, a difference Nadia could quantify if she had wanted to, but mainly just noticed. Verrill had said nothing official, but had begun consulting her informally on medical response protocols, treating her knowledge as something the clinic should account for. Dufresne had stopped doing the lingering near the entrance thing and had simply started asking direct questions, which she preferred. Okoro, the medic who had arrived at the HMMWV, had sent her a message through the clinic's internal system that said only, "Good work Thursday," and had signed it with his rank. Mark Peterson had said nothing at all, which she understood. He was processing. That was fine. She had given him nothing to process except the simple fact of her, which was sometimes the most complicated thing to hand someone. Sergeant First Class Carver came in for his initial physical therapy evaluation 3 weeks after the accident. He arrived early, 5 minutes before his appointment time, and sat in the waiting room chair with the careful posture of a man with a fractured tibia, doing his best to look like a man without one. When Nadia came out to get him, he looked at her for a long moment, and then he said he hadn't put it together. That she was the one from the parking lot. That she was the one from the HMMWV. 3 encounters, and he had processed them separately. She said that was usually how it worked. He said he had asked around about her. She waited. He said people had told him things that he was still figuring out whether he believed. He said the Ranger thing, specifically, had given him some trouble. She said she understood. He said he wanted her to know, and he said this with the directness of someone who does not say things casually, that he was glad she was here. Not in the abstract way people say that. He meant it in the specific way. Her, this clinic, this installation, doing this work. She thanked him. She meant that in the specific way too. She told him they were going to start with range of motion assessment and build from there, that she expected him to be at 80% in 4 weeks and at full capacity in 12, and that both of those projections assumed he was going to do the exercises she assigned him instead of skipping them because he felt better than expected. He said, how did she know he would do that? She said she had seen it 800 times. He laughed. It was the honest kind of laugh, the kind that means something surprised you into it. The work began. The quiet, daily, irreducible work of helping someone recover what they had lost. The calibrated pressure and the measured patience and the precise knowledge of how much to ask and when. The work that Barb, with her strong opinions about fascia and her stronger opinions about potential, had recognized in Nadia long ago and had known would find its place eventually. The bracelet on her wrist. The same one, still turning. She went back to Hamtramck in April for her nephew's birthday, Tomasz's youngest, who was turning 7 and had demanded a party with a specific type of frosting that had required Tomasz's wife to make 3 phone calls. The house was full of the sound of children and the smell of food and the particular warmth of people who know each other well enough that they do not need to perform being comfortable. Tomasz found her in the backyard after the cake, the two of them standing near the fence where they had stood as kids watching the neighborhood in its daily commerce. He had aged into his face in a way that she liked. The lines from squinting and thinking and sometimes laughing settled into something that looked like earned character rather than simple time. He asked how Fort Drum was. She told him about January. Not all of it, just the shape of it, the HMMWV, and the chest seal and the way things had changed afterward, in the small but real ways that things change when people learn who they are actually dealing with. He listened. He did what he had always done, which was listen entirely, not waiting for his turn to speak, but actually receiving what she said. When she finished, he looked at the bracelet. He had been looking at it at intervals all evening, the way he had looked at it the first time, years ago, when she came home from Coast Province with it on her wrist. He said that it seemed like things were settling. She said yes. He said she had been trying to go invisible for a while. He did not say this critically. He said it the way he said most things, as an observation, a data point being offered. She thought about this. She turned the bracelet once. She said she had not been trying to go invisible exactly. She had been trying to be seen accurately. Those were different projects, she said, even if they sometimes looked the same from the outside. He thought about that. He nodded slowly, the way he nodded when something had reorganized itself correctly. He said that made sense to him. The kid from Coast City had given her the bracelet because she had shown up and done what needed doing, and then asked for nothing in return. Not recognition, not gratitude, not acknowledgement of what it had cost her to be there in that valley and those mountains doing work that was violent and tender in alternating measure, sometimes in the same breath. He had given it to her because he had seen something that deserved to be named, and the name he had found was soldier hands. But healing. She had worn it every day since, because it was the most accurate description she had ever been given. Not because it captured everything, but because it captured the essential thing, the thing that had been true at 24 and was still true now, the thing that Ranger School and 3 deployments and a master's degree and 14 months at a military clinic had not changed, but had only clarified. Some people are built to hold 2 things simultaneously that other people think cannot coexist: precision and compassion, force and care, the capacity for violence and the commitment to healing. The world tends to put these things in different boxes, different people, different professions, different uniforms, and sometimes a person comes along who carries both, not as contradiction, but as wholeness, and the world does not quite know where to put them, so they put themselves somewhere useful, and they do the work. The bracelet was dark green paracord in a Solomon bar weave, worn now to the color of old leaves. She wore it on her left wrist, every day. It had been given to her a long time ago by someone who saw her clearly. She was still trying to deserve it. What happened in January at Fort Drum spread, in the way these things do, through the specific network of military medicine, through after-action reports and informal conversation, and the occasional email from someone like Okoro, who had seen something worth acknowledging. It reached Viril's desk in a form that prompted him to update certain administrative records. It reached the ears of a training officer at the hospital, who subsequently reached out to Nadia about updating the clinic's mass casualty protocols, specifically the question of whether civilian contractors with military medical backgrounds should have a more explicitly defined role in emergency response planning. She said yes. She helped write the new protocols. She did this without ceremony, without the kind of institutional positioning that would have been available to her given what she knew and what she had done. She wrote them because they needed to be written, and because she knew how to write them, and because the goal was to have better protocols, not to have written better protocols. That was the distinction Tomasz had understood before she said it. She stayed at Fort Drum. She continued seeing patients, continued the steady work of physical therapy, continued getting there 30 minutes before her shift with her coffee and her ordered workspace. Carver made it to 80% in 4 weeks, as projected, and to full capacity 2 weeks ahead of schedule, because he had done the exercises, which surprised him and had not surprised her. Patel came in early on Monday mornings and asked questions, and Nadia answered them. She taught the way Barb had taught her, directly, with rigor, without withholding the things that were hard to know. She told Patel once that the most valuable thing she had learned in her career was the difference between confidence and certainty. That confidence was what you carried into an uncertain situation, and certainty was what you pretended to, in order not to have to be afraid, and that only one of those things was actually useful. Patel wrote this down. Nadia did not ask her why. Some things deserved to be written down. There is a particular kind of invisibility that skilled people sometimes wear, not from cowardice, but from a kind of discipline. The understanding that the work itself is the point, and the recognition is noise around it. And there is a particular moment, usually unplanned, usually inconvenient, when that invisibility becomes unsustainable, not because someone exposes it, but because circumstances require what only that person can give. Nadia Ostrowski was a physical therapist. She was also a veteran of 3 combat deployments, a graduate of one of the most demanding military schools in the world, and someone who had spent over a decade building exactly the capacity she was now using to help soldiers recover from injury and return to duty. She didn't advertise this. She didn't need to. The bracelet on her wrist was dark green paracord in a Solomon bar weave. A kid in Coast City had made it for her with careful hands. It meant that someone had seen her clearly, once, in a moment that mattered, and had found the words to say so. She wore it every day as a reminder that being seen accurately is worth more than being seen widely. That doing the work is the point of the work. That the soldier in the back of a HMMWV in January does not care what your title is. He cares that your hands know what to do. If you made it this far with this story, here is something worth sitting with. Nadia's background is fictional, but the combination it represents is real. There are people working in civilian roles right now, in clinics and hospitals and schools and offices, who carry military experience that their co-workers would not expect, who chose not to lead with that history because they were building something new, or because they understood that expertise proves itself in the work rather than in the announcement. The tendency to underestimate someone based on their current role rather than their actual capacity is one of the most common and costly errors in any organization. The person sitting across from you in a context that implies limitation may have operated in contexts that required everything. Nadia knew this. She had been underestimated enough times to develop a precise taxonomy of it. She had also been seen clearly enough times to know that it was possible. That is the story here, underneath the one about the chest seal and the bracelet and the frozen parking lot. Someone doing excellent work in a context that does not fully reveal them. Someone waiting, without resentment, for the moment when the work speaks for itself. It always does, eventually. The question this story asks is not whether you would be surprised by a Nadia in your own workplace. The question is what assumptions you are currently making about the people around you that a crisis would prove wrong, and whether you might revise those assumptions before the crisis requires it. Drop your answer in the comments. Tell us whether you have worked with someone whose past turned out to be far more than their present role suggested. What did you assume, and what changed your mind? The most interesting stories are usually in the replies.